Grommets are little plastic tubes that are inserted into the eardrum to treat children with glue ear. Glue ear is caused by a build-up of fluid in the middle ear behind the eardrum. It can lead to problems with a child's hearing. This can have effects on speech and language development, education and behaviour. The grommet allows air through the eardrum into the middle ear and prevents the build-up of fluid. This allows the middle ear to work normally and the child to hear properly. Mrs. Kutsi, hello.
Hello.
Johannes, how are you?
Fine, thank you.
Good. Are you all ready for your operation this afternoon?
Yes. It doesn't hurt.
Doesn't hurt, no. He's just not able to hear all that well. So he's hearing the same way as you having your head underwater. So even if there is just a mild hearing loss, it has an impact on their learning in school.
So how are grommets fitted? Well, the first step in the operation is an anaesthetic, which is normally a general anaesthetic. This means that the child is fast asleep. Modern anaesthetics are extremely safe and are given by an anaesthetist, a highly trained doctor. Once the child's asleep, a small tube is placed in the back of the throat to help them breathe through the operation. The next step is to put the grommets in. Because they're so tiny, the surgeon uses a specialised operating microscope. The surgeon will make a small nick in the eardrum and then use a fine sucker to draw out any fluid. There we go. And the grommet, please. So this is the grommet, and this is what's going to go in the ear, like putting a button through a buttonhole. So I'm just going to take this. Once the grommet's in place, the surgeon will move on to the other ear and repeat the process. Once both ears are done, the operation is finished, so it only takes a few minutes. The anaesthetist will wake the child and take them to the recovery room, where they will be monitored and painkillers given, if they're even needed. This is a very safe operation, and the risks are extremely rare. Because a grommet is a foreign body, the main risk is that of infection. This is usually characterised by a persistent discharge from the ear. It's best treated by antibiotic drops, but if these don't work, then sometimes the grommet will have to be removed. The grommets tend to fall out on their own after 9 to 12 months, and the hole where they were sited heals up on its own. Soon after the operation, the child will be able to go home. Sometimes the surgeon will prescribe painkillers, but these are rarely required. A day, or possibly 2 off school is all that's needed to get over the anaesthetic and the operation.
Yeah, I think it went very well, and Johannes is fine. I am very relieved that it's over and done with, and it was quick and it was good, and we're forecasting that it's just going to be good news for Johannes in the months to come.